Hello, I'm Dr. Bob Parry, the Director of Pediatric Surgery at Akron Children's Hospital in Akron, Ohio. I wanted to spend a few minutes today talking to you about skin cancer, what it is, and things you can do to prevent it. As I'm sure you're well aware, it's a big problem all around the world. The incidence of skin cancers in the United States are about 3.5 million new cases a year. Now, most of these are not the one that we supposedly worry about, which is called melanoma. Melanoma is only about 2% of all the cancers that occur in the United States, with about 70,000 new cases a year. The reason it gets a lot of fanfare, and rightfully so, is it's the one that can actually more likely kill you. And in fact, more than 90% of the deaths from skin cancer are related to melanoma. But people look at the numbers and think, well, the risk isn't that high, it can't be that big a deal, maybe I'll be one of the lucky ones. Well, they also forget of those 70,000 melanoma patients, as I mentioned, there's over 3 million other skin cancers. And these skin cancers, which are called basal cell carcinomas or squamous cell carcinomas, while they're less likely, significantly less likely to kill you, can absolutely cause many problems throughout your life. They all need to be removed by someone like me. A surgical event. You need to have it either surgically excised, maybe it's frozen off, but some procedure to get it taken care of. This results in scarring, it results in time at the doctor getting things done, and if you have repeated ones, it can be part of your life monthly for a good long period of time. It's something clearly you would want to avoid if you could. Obviously, none of us want to get melanoma, that's the one that's riskier. But none of us want to get any of these skin cancers. They're all a problem, and they're all something that can cause a lot of trouble throughout your life. And the interesting thing about it is the majority of them can be prevented with pretty simple measures. We know that the vast majority of skin cancers are caused by exposure to ultraviolet radiation, which is primarily what we get from the sun. But tanning beds and things like that are also culprits. Wherever there's ultraviolet radiation, you're at risk. Now, we also know that preventing this exposure can prevent the incidence of skin cancers, all three, squamous cell carcinoma, basal cell, and melanoma. Because what happens with the problem to develop the cancer is that the UV light damages the DNA of these various skin cells, and these are the three different types of skin cells that get involved. And what it makes them do is grow inappropriately. They keep growing, and that becomes a big problem. So you need to prevent that UV from damaging your skin cells. And it sounds pretty simple. You would think, geez, just covering up or not getting exposed would make a difference. And it absolutely does. And that is how simple it is. Skin cancer is absolutely one of the most preventable cancers that humans are presented with. And simply covering up makes a huge difference. Now, this has been known for a long time scientifically, and has been grasped by many countries around the world as a public health message, and probably no more so than in Australia, which started in 1981 with the Slip, Slap, and Slop campaign to prevent the occurrence of melanoma. Now, since 1981, the country has been super aggressive about making a large public awareness program in place, and in fact, in 2014, Australia became the first country in the world that showed a decreased incidence of skin cancer, obviously directly related to the long public health campaign that had gone on. The United States is certainly in on that run now. They have a Slip, Slop, Slap, and Wrap campaign. The original Australia was Slip, Slap, Slop. What those stand for is pretty simple. Slip on some clothes that protect you from UV radiation. They're usually marked nowadays. Again, thin clothes that let the sunlight through aren't going to help you as much. Slop is putting on sunscreen. Sunscreen is a tremendous help, particularly if it's over 30 SPF. That's protection factor that you want to look at. Less than 30 is really not helpful for you. You should always be something greater than 30. It's a big help, particularly with active sports, swimming, surfing, things like that, where clothing isn't appropriate for it. But it's important to remember that even with sunscreen, some of the ultraviolet rays penetrate, and in fact, unfortunately, some of the melanoma-causing rays are not blocked by sunscreen. Slap is the easiest one of all. It's a hat. Slap on a hat. It's simple, and it is completely effective at reducing the sun reaching in the skin of your face and head. Wrap is a newer one added on now, which is protect your eyes with wrapping on some sunglasses. But the key thing is, it's really simple to protect yourself and super important that you do so. In fact, in Australia, there's a no hat, no play rule for all kids. You can't go play from public school if you don't have your hat. Every kid shows up at school with a hat and goes home with a hat. It's a great and simple way to be able to do things, because preventing UV exposure throughout life is what helps prevent the occurrence of cancers later in life. So not only is it simply protecting yourself from the sun, but the sunburns that they cause, and particularly sunburns when you're younger. Sunburns that lead to blistering are an absolutely known risk factor for developing skin cancers later in life. So you start protecting yourself right at the beginning. Slip, slap, slop, wrap. Get some clothes on, get some sunscreen on, absolutely wear a hat, and put on some sunglasses. All of those will significantly decrease your risk of developing skin cancer in your lifetime. Thank you.